Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. We're talking about the one, the only Mark Cuban, and we were talking to him about his company, Mark Cuban's costplusdrugs.com. And it's such an incredibly positive, disruptive company. They currently have 150 plus medications on their website where you can get generic versions of common drugs for just 15% above the wholesale, plus a $3 pharmacy and a typical $5 shipping fee. And it's unbelievable. The savings that people are getting on these drugs are just unparalleled. And you need somebody like a Mark Cuban who can go in there and say, I don't need to worry about, the profit or making somebody mad because I can afford to do this. And that was part of what he talked to us about. He said, when you get to his level of success, you can pick your profit. That doesn't necessarily have to be monetary profit. It's being able to disrupt this industry that has been so it's like the Wild West. There's nothing. I told him, I said, it sounds like healthcare in so many ways is like shopping for a car. There's no transparency. There's no nothing. And unless you go in with all the information, you just don't know what you're getting into. And you just are able to fall victim to whatever the heck people are, because you're not shopping around when you have an emergency situation. You're thinking who's closest, who's fastest, who's available, all those things. And so for him to put patients in the power position, whether you have insurance or not, because you can use this if you don't have insurance, as long as you have a valid prescription. And you can also use it if you do have insurance, you just don't use your insurance, which other models use too. This is just affordable, more affordable, he said, in many times than copays, even with insurance. So it's for anybody, and you can pay super reasonable prices for these drugs, which is imperative. Before we got on the call with him, I just read an article that said 42% of Hispanic Americans are not taking their prescription medications due to costs, and that more than half of every dollar spent in the on drugs in the US went to middlemen, which is exactly what he's cutting out. So he's making incredible progress. I love what they're doing. It was an incredible conversation. He talked to us about healthcare in general, prescription drugs, middlemen, all the things. And so it's a great interview. I was so honored to be able to chat with him about it. Apoorv, what were your takeaways from this?
Yeah, Stephanie, it's a thrill of a lifetime, really, to be able to speak with the preeminent entrepreneur, disruptor himself, and just, he was able to answer every question that we had and was so eloquent because he's thought about this for a long time. It's not simply the next opportunity that he's picking up, or just because he can, or because he can put his name on something and he knows it's going to work, right? That's not what this is. He's researched this in depth. He's studied it extensively. He's gone and tried to understand the health system in Canada as a comparison, to try to understand why are the costs cheaper there. He's tried to figure it out in this country. Why are the costs so high here, and why is there no price transparency? So it's really provocative thinking on his part. I think that the fact that he's able to come in because he's already so established and successful, and he's got a tremendous name recognition, he's able to come in and do things differently, as you were alluding to also, that maybe the typical startup might not be able to do, and they might get more challenge from within the industry. He might certainly be facing some of that as well, but I think he has the power to withstand that. And because he's so motivated with the primary aim of disruption, with the goal of really helping the most disadvantaged populations, I think that makes it particularly exciting. It's actually a fairly simple concept. On the face of it, you might think is just about providing the lowest prices, and there's plenty of other providers like that out there, but that's actually not what he's trying to do. He's trying to really change access, and he's trying to change the way in which the healthcare system is delivered. So I find that particularly inspiring, from my day job as a consultant, to be able to go back and work with my clients and help them to think, how can we think boldly and more courageously about the disrupting the status quo that is preventing us from making progress. So hats off to you. Hats off to our intern Mackenzie, who managed to get us this amazing interview by just reaching out to Mark Cuban. It was absolutely fantastic. So I'm thrilled with the opportunity, and I hope our audience is as well.
Absolutely. It was a fabulous interview. And if you haven't gotten a chance to watch it, make sure you go back and watch it. I will post the link to the full interview in the copy for this. So thank you all, and we'll talk to you soon. Bye-bye.
Bye-bye.